Hello and welcome to another short video of Dr. Barbara Miller's NCLEX review or State Board of Nursing examination. Today we're going to be talking about pancreatic cancer, which can be a lethal diagnosis. Okay? So carcinoma has a vague symptoms and is usually diagnosed in the late stages after the liver or gallbladder has been invaded. It is high mortality rate. So what are some contributing factors for pancreatic cancer? Tobacco use, chronic pancreatitis, diabetes mellitus, cirrhosis of the liver, high intake of red meat, inherited risk. Okay, small have an inherited risk or just plain old age. What are some clinical manifestations of pancreatic cancer? Fatigue, anorexia, flatulence, pruritus, itchy skin, weight loss, drastic weight loss, palpable abdominal mass, abdominal pain may radiate to the back, hepatomegaly, enlargement of the liver, jaundice is the late signs of pancreatic cancer. Okay, ascites, fluid in the abdominal cavity, clay-colored stool, dark urine, glucose intolerance. How do they diagnose this? Carcinoembryonic antigen, like the CEA levels. Expected finding is less than 2.5 for non-smokers, less than 5 nanograms per milliliter for smokers. What are some critical findings? Greater than 6 nanograms per milliliter, elevated serum amylase and lipase, elevated alkaline phosphate and bilirubin. They also will do the E as in Edwards, R as in Road, C as in Charlie, P as in Paul. They will do also ultrasonography and CAT scan. These patients need lots of collaborative care. Pancreatic cancer is life-threatening situation, more so as mentioned when it invades the liver and your gallbladder. So what are some nursing intervention? Palliative care measures, pain management, monitor blood glucose levels, provide nutritional support such as enteral supplements and TPN. Enteral is cheaper and less infection than the TPN. Medication, opioid analgesics, morphine or hydromorphine. Remember, when you give morphine, you want to chart the patient's respiratory rate. What are the therapeutic management? Chemotherapy may be used to shrink the tumor size. The nurse monitors for myelosuppression and pancytopenia. Radiation therapy, partial pancreatomy for small tumors. Just remember the Whipple procedure. What is the Whipple procedure? The pancreatoduodenoscopy is the most common operation to remove pancreatic cancer. Procedure done with cancer is located when the cancer is located in the head of the pancreas. And this involves removing the head of the pancreas, the duodenum, parts of the jejunum, and the stomach, gallbladder, and possibly the spleen. The pancreatic duct is reconnected to the common bile duct, and the stomach is connected to the jejunum. And this may be done by laparoscopically. So what are the nursing interventions? You want to provide routine post-operative care for these patients. You want to monitor their nasogastric tube. You want to observe for bloody or bile-tinged drainage, which can indicate anastomotic disruption. The patient should be in a forward position to prevent stress on the suture line. And you want to facilitate coughing, deep breathing, use the incentive spirometer to decrease risk factors for pneumonia. You want to monitor glucose and administer insulin as needed if the patient is on a TPN. Client education. Encourage the client to seek palliative care, cancer support group available, and support measure for pain. Thank you for watching this short video. Hope it benefits your preparations for the State Board of Nursing examination. Please like, share, subscribe to the channel to help it grow. See you in another video. Thanks.